Most pet owners will tell you they would do whatever they have to do to help their four-legged family member if they're injured.
You know, in some cases, the only option is surgery, but now there's a new alternative which can enhance the chances of recovery after surgery, or in some cases, even replace it with stem cell injections.
Emma. Emma. Come on. When I come home, my wife and I are just mom and dad.
Gracie and Emma are both 7.
This one is the one that saved our hearts because we had lost 3 in 1 year. And then this one came in as a puppy, just 10, 12 weeks old. So she took care of us more than us taking care of her.
Running around the house recently, Emma tore her ACL.
As soon as she planted her back right foot on the landing, she just yelped like I've never heard her yell before. And that's when I realized she was limping extremely bad. He said it looked like someone put a stick of dynamite in her knee and just shattered everything. See?
After surgery, Emma injured the knee again. This time, Dr. Joe Gaston at Crabapple Knoll Veterinary Clinic suggested trying an injection of stem cells.
We use them in cruciate injuries, which is an ACL in people, and it doesn't regrow the cruciate, but what it does is it helps it repair itself faster. So a lot of times we've avoided some surgery. It helps toward cartilage. For
Emma and the Carrels, the stem cells were a new lease on life.
It was like a miracle. It was absolutely like a miracle.
This is what the product looks like, and it comes in a small vial.
Veterinarians have actually been using animals' own stem cells for the past 6 years or so, but only in the last couple of years have they used human stem cells.
So that's what it looks like, and it's 1 cc of frozen stem cells. The advantage of these is they're capable of differentiating into any tissue, where when you get them from your abdominal fat or somewhere else, they can only differentiate into muscle, fat, bone, skin, things like that. They can't differentiate into everything.
The stem cell therapy worked so well on Emma.
We're going to pre-treat with a K laser, cold laser, to reduce inflammation in the knees. We're going to give a little bit of a pain drug sedative. You won't even notice any difference. They don't do a local. We'll inject them, take them off the table, and you take them home.
Wayne and his wife decided to use it as a preventative measure on Gracie.
Come on, sweetie. There we go, sweetheart. There we go.
This time, no anesthesia required.
Stem cells, we classify it as regenerative medicine rather than trying to do the repair ourselves. We let the cells do it. Basically, they're undifferentiated cells that differentiate into whatever is damaged, and they repair or replace it.
In under 30 minutes, Wayne and Gracie are headed home, looking for many more healthy years together.
It's been a blessing. I couldn't imagine my life without them.
Now, we should point out that the procedure is not inexpensive. It runs about $1,000. Dr. Gaston says when you consider spending, $50 or so a month on medication for a dog for its lifetime and the side effects that many of those medications have, you actually come out ahead. Crabapple Knoll gets its stem cells from a company called Vetrogenics, and we put a link to Crabapple Knoll's website on our website, myfoxatlanta.com.
Very interesting. It worked well for Emma. Are those results typical?
Dr. Gaston is very honest, and he says using these human stem cells is fairly new. They've been using them for the last couple of years, and he said it's not 100%. Sometimes it works 100%, sometimes not. But you just have to be aware that, it does come with that percentage.
Sure.
So for Emma, it worked, and so far so good with Gracie. I got a text from Wayne over the weekend saying she was doing really well, too.
Good news.
Okay.
All right. Good Day Atlanta will be right back. Stay with us.